Actually, I spent a good deal of time with Congressman Ryan. When his plan came out, I applauded it as a very important step. I said my plan would be a little different, or would be different in some respects, but that we were on the same page. This is a place where Speaker Gingrich and I disagree. He called this right-wing social engineering. I believe it's a very important step to protect Medicare and to protect Social Security. We're going to have to make changes like the ones Paul Ryan proposed. My plan is pretty straightforward. First principle, for people who've already retired or who are near retirement, nothing changes. Keep the current system in place. Don't want to have people that are in their 70s having to think about a new program of some kind. So for those folks, we keep things the same. For you and for Josh, I'd change the program. And what I'd do is this. I'd say that when you retire, you're going to get a premium support, or it's almost like a voucher where you're going to get money that you can use to either buy standard Medicare or you can buy a private plan with that premium support. And by the way, if you're low income, you're going to get more than if you're very high income. Because high-income folks can afford to buy some insurance on their own and can afford their own way. People of lower income will need more help. So my plan says more for lower-income people, less for higher-income people, and you get a premium support amount that you can use to buy whatever plan you want, standard Medicare or a private plan. It's pretty similar to Paul Ryan's. What I added that he did not in his first proposal was the option of purchasing, if you wanted to, standard Medicare. That sounds kind of complicated for some of you here, but I want you to know that the advantage of all this is it allows us to keep Medicare solvent and making sure it can do for you and your generation and Josh's generation what it's done for many of the people in this room, which is to never have to worry about being able to get health care that's a quality health care product as you're a senior citizen. And I want to make sure that happens. At the same time, I don't want to raise taxes on you to such an extent that you can't save for your future and live the life you'd like to live. So that's how I've balanced that, and I applaud what Paul Ryan did, and even though you're from Wisconsin, I appreciate your being here today and asking the question. Thank you. Yes, ma'am.
I don't mind telling people that I'm 37 years old, and my husband and I are responsible homeowners, and we pay our mortgage, and we are saving for retirement privately. I personally do not believe that Social Security is going to be there for